bottom of your control panel. We typically get a lot of questions, and we do have more than 250 people on the webinar today, so we won't be able to get to everything. But any of the questions that we do receive from you that we don't answer live on the webinar will be answered later, and we'll post the answers to our website. So a few more details on the GoToWebinar interface. The way you ask questions or send a comment or other information to us, the organizers, you can type it into the questions pane of your control panel. And as I said, we'll try to forward the questions to Natalie and get to as many of them as we can. Sometimes the GoToWebinar control panel has a habit of disappearing. So the best way to do that is to make sure that up at the top you click on File, and then the part of the control panel that says auto hide the control panel, and that allows you to either hide it or to keep it live all the time. Make sure that that's checked and it will stay visible to you. So moving right on to the webinar, to the interview part of our program here. First of all, what I want to do is make my apologies for Cindy Roat, who was scheduled to be on the webinar with us today and actually conduct the interview with Natalie. Unfortunately, yesterday she was called for a trial jury at the last moment, and so she's going to be busy, I think, for a couple of weeks doing something that she didn't have on her calendar at this time. So she regrets that she can't be here with us, but I'm very happy to be doing this interview myself because I've known Natalie for a very long time and have been so impressed with the work that she's done over the years in this field. Like many people who work in the field of cross-cultural healthcare, she is multilingual. She's fluent in Spanish and English, and she's also studied French, Italian, German, Arabic, and Japanese. She has been working since 1996 in the language services industry in a variety of capacities, including as a court interpreter, a freelance translator, and as a member of upper management in some of the world's largest translation and interpreting suppliers, including Language Line Services. Her latest book is called Found in Translation: How Language Shapes Our Lives and Transforms the World. She's also the author of another book called Telephone Interpreting, which was the first book ever written on the topic. Right now, she works at Common Sense Advisory, and she is in charge of the company's research services. And she has been widely published, including in Business Week, the New York Times, been on NPR, written in the Wall Street Journal, and has her own blog. And she has interfaced with government agencies and translation services in the United States and around the world. So she has a tremendous number of credentials that make her perfect to have written a book along with her colleague on this topic. And we're very, very, very glad to have her here. So welcome, Natalie. And before we get started, I just want to say that I'm signing to this webinar myself at 5 a.m. in the morning from Kobe, Japan, where I've lived for the last year. And while I speak several languages myself, and I've lived in a couple of different countries, every single day in Japan I have a new appreciation for language barriers and translation and interpretation. And in fact, right now I'm sitting in my Japanese tatami room shivering because a few weeks ago somebody in my family fooled around with the control on the heater, and we haven't been able to get it to work since because there are 10 buttons on the control and each one of them is in Japanese kanji. And though I've been studying the language for a year, I still can't read these buttons. So I was particularly chuckling in your book, Natalie, when you were writing about how translation isn't just important in the very important and life-saving areas of life, but also in the really mundane areas of life. And there are many, many instances when I wish that I'd had a translator or an interpreter around to help me get through my everyday life in Japan. So let's just get started with the first topic here. Just to get us going here, for those people who don't know the book, can you explain to us what it's all about?
Sure. And before I do, I just wanted to say thank you so much to Julia and to Candace and Brittany, everyone from DiversityRx who has enabled this webinar today. I equally am a great fan of the work that DiversityRx has done and all the great work with the Class Talk listserv, which I constantly read and enjoy, as well as the conferences. And very much looking forward to the conference in March, as I know many people are. Regarding the book, those of you who do subscribe to the Class Talk listserv may remember a few years ago I sent out a message saying that I wanted to capture stories about interpreters and stories about how interpreters were changing people's lives and changing the world. Well, that was back in 2007, and it took me a while to make this book a reality, and it changed its scope and it changed its title and its focus slightly, but the underlying goal of this book was always to showcase language and overcoming language barriers and how important that really is, not just in the grand scheme of things, but in our everyday lives, like Julia said, with the little things. In the book we included a series of stories, 89 different stories in lots of different areas that we'll show you in a second. But really I wanted to show that translation and interpreting affect every part of our lives. And so this book is a way to do that. One of the common challenges that we face, anyone who's working in cross-cultural communications, cross-cultural health, is helping people understand how important this work really is. And so I felt, at least we can take one aspect of this, which is language, and show people what a huge difference language barriers can make and overcoming them can make. So that's basically the thrust of the book and the main focus and why it was written.
And you do a great job of describing that in a variety of different aspects of life. So very, very enjoyable stories that you use to illustrate all of those points. So tell us why you think this book matters, particularly for people who are working in healthcare.
I think that we have lots of stories in the book about healthcare and human rights. The very first chapter of the book has several stories, and hopefully I can mention them in a little bit more detail throughout this webinar. But I think anyone who's working in healthcare, when we talk about language access, we're often thinking about access to care and access to services. But the reality is that anyone who's facing a language barrier is facing barriers of access in other aspects of their lives as well. So everything from access to commerce and business and the ability to go and buy something, or the ability to turn up your heat if the buttons happen to be labeled in another language. So I wanted to help healthcare professionals in particular with this webinar to understand that language barriers are not just present in terms of that singular aspect of people's lives, that someone who is dealing with language barriers may be encountering them in many different aspects of the system. Not only when they're getting access to care, but maybe even in enrolling for insurance benefits, going to fill a prescription at the pharmacy, even calling a crisis line if they are experiencing abuse in their lives. Simple things like that. Even things like going to a store to buy a product that perhaps, like a compress or something that you don't even need a prescription for.
Yeah,
I'm sorry?
ahead.
Oh,
I was
go
going to
ahead.
say flour and sugar, for example, which is or salt, which is a common dilemma we have here in Japan. They all look the same, but of course the letters are completely different.
Exactly. Yes. Well, and I have to tell this story now. It's not one that I included in the book, but since you mentioned sugar, when I was an interpreter, interpreting over the phone, I interpreted for a speech therapist. And the speech therapist had a Spanish-speaking patient she was taking her through a series of exercises. And she asked questions like, who drives the bus? And the answer that she was looking for was the bus driver. So the patient would respond with the appropriate answer. Who brings you the food at the restaurant? And the woman would respond, the waiter. Well, she asked a question who do you borrow a cup of sugar from? This is a very culturally loaded question. That might be an appropriate question in the United States, but the woman had absolutely no idea what the therapist was talking about. And so I had to interpret this question, but she couldn't answer. She actually asked, well, why would I need a cup of sugar? For her culture and her diet, this was just not something that she would have needed. So, it's a perfect example. If you need to buy sugar, you need to buy flour, you need to, we all have our different daily needs in terms of our cuisine, our cultural preferences. And language really can be a barrier for all of those things, definitely. So you can see on the slide here some of the different areas that we cover in the book. These are actually the chapter titles condensed to just the areas. But for people in healthcare, there is a whole chapter with stories about healthcare and human rights, but also all of these other different areas of life that I think are very interesting for people to know how translation and interpreting really matter in those areas.
Great. So you did have quite a number of stories in the book. In fact, I was very pleased to see that the book starts out with stories that relate to healthcare. And I know this is because of, first of all, because they're stories of urgency and stories that are very important in people's everyday lives. Can you tell us some of the stories that you think are most illustrative of how important language and perhaps even culture coming in get illustrated in your book in healthcare?
Sure. So one of actually the very first story in the book is a story about a 911 call. It's a story from my personal experience when I was interpreting, and a woman was dialing 911, and I knew it was a real emergency because I heard a woman whispering that she said, "He's going to kill me." Those were the words that she whispered. And so the dispatcher had to ask a series of questions. Where is he? Does he have a weapon? Those kinds of questions. And throughout the call, it was revealed that she was hiding under a bed, and the man was in the house, and he had a gun, and she was fearing for her life. And the whole time, she was whispering. And it's one of the most intense calls I've ever taken because I knew as the interpreter that my life was her life was truly in my hands, and getting the right answers would enable the dispatcher to get the police to the scene. And I think a lot of times in healthcare, healthcare professionals working in an emergency room only see the view of that patient when they come in. They don't know what barriers they might have faced prior to that. So that story does give a glimpse of that. Of course, I had to tell the story about the famous word intoxicado, which many people who read the Diversity RX class talk list are very familiar with. This particular story of a single misinterpreted word that led to a series of events and was actually misinterpreted as intoxicated. For those of you who aren't familiar with this word, it's what's known as a false friend. So it looks like intoxicated, but actually doesn't mean intoxicated. Intoxicado really means something more like poisoned. Intoxicación solar is sun poisoning. Intoxicación por alimentos, food poisoning. So when you think about intoxicación, it's a state of poisoning. So intoxicado is not an easy word to render, even for a very highly skilled, highly trained interpreter, because they need more context to figure out which type of intoxicación the person has. So this particular case, to give you just a brief summary, this particular instance led to a very healthy young man becoming quadriplegic and resulted in a $71 million lawsuit. So this is a prime example of the importance of having trained interpreters, and the reason that just simply speaking a language doesn't qualify you to interpret. The person in this case who interpreted was a bilingual nurse who spoke Spanish, spoke English, but was not trained in medical terminology and not trained in interpreting skills. There's another example that we list in the book. I'm only giving you a few here. But one that I think is really important is one about the Mayo Clinic. That particular story I think is important because there was an interpreter named Carol Hidalgo, and she started to notice certain symptoms among several different patients that were being treated by different doctors. And they thought that there might be an outbreak about to occur because of the symptoms that were showing up in different patients who all happened to speak Spanish. Well, it turned out that all of these patients ended up working in the same meatpacking plant. And what was happening is that there were some safety conditions that were not being followed. So basically swine brains were being liquefied, and some of that fine mist was getting into their system. And as a result, there were foreign particles that were attacking the myelin, and their nerves were actually getting injured. They were having symptoms similar to what multiple sclerosis patients experience. So it was the interpreter who spotted this pattern. None of the doctors did because they were all treating different patients. But that interpreter, because she had a different view of the system, different view of the patients, was actually able to catch that, and they were able to prevent it from happening to more patients. So I really love that story. Another story that we mention in the book, I labeled it here, This is America, Speak English, to sum up the sentiment of so many people. One of the stories that we included was to talk about Title VI of the Civil Rights Act and to talk about the legal ramifications of not providing language access, but also to talk about why it makes sense for people in society to support language access and how it can benefit individuals. If your child or your family member, your loved one, is a victim of a crime and the only witness happens to speak a language other than English, suddenly you care about translation, you care about interpreting, no matter who you are. So we make that point in that particular story. We also included some stories about some other language groups and communities. I listed a few of them here. In Europe, the Romani, and right here at home in the United States, where I live in New England, there's a group called the Wampanoag who have actually revitalized their language and brought it back from extinction. And we write about that and the role that translation played in that. We also write about the role of translation for languages like Irish Gaelic and Inuktitut. And the main point in that chapter is that language rights are ultimately about access. And so that is really, just those are a few examples of the stories that I hope really illustrate the point of that chapter.
I have to say, one of the things that I really loved about the book was the stories that you used to illustrate all of these points. The first one that you mentioned, the one about the 911 call, just had my hair standing on end when I was sort of listening to you in the book recall how the phone call went, and the fact that as an interpreter you actually didn't know the outcome of that story, which often happens many times for interpreters in a variety of different situations. But the stories are fantastic, and you can just keep reading them and reading them. Very, very interesting. One of the things that you do in the book is that you mix and go back and forth between interpreting and also written translation. And I think that there was a story of particular interest to healthcare professionals in the book that's about translation and the nexus between translation and technology. Tell us a little bit about those.
Yes. And it is true. We do go back and forth between written translation and interpreting, and I was a little worried when the title for the book was chosen, Found in Translation. I thought, oh no, all the interpreters are going to be mad at me because everyone calls them translators by mistake. But we did really try very hard in the book to show people the difference between translation and interpreting that are, of course, very different professions. But I think to your point about written translation and the stories in the book, one of the ones I wanted to mention today is one about after the earthquake in Haiti. There was a project called Mission 4636, and a linguist by the name of Rob Monroe at Stanford, and he developed a method for processing large volumes of text messages, SMS messages, in less common languages. And so the way he did this was by crowdsourcing, basically by having an online chat room and having volunteers who could crowdsource the translations in order to get help to people. Because the problem was most of the rescue workers did not speak Haitian Creole. And they were coming in, international aid workers and rescuers. So as a result, they couldn't understand what people were trying to communicate to them. So this particular story, I think, is very interesting to show how written translation and technology could help in a time of crisis. There is another story that I wanted to mention as well that I think is of interest to healthcare workers and people working in cross-cultural health. And that is a story about a system that is called the Global Public Health Intelligence Network. And this sounds, I don't know if you've heard of this before, but this is basically a system that enables outbreaks to be prevented. So this is the system that first caught the SARS epidemic, and it basically prevents outbreaks or tracks instances of the beginnings of outbreaks by using automatic translation. So what this system does is it scans all kinds of news articles, news items in English and 8 different languages. And so it automatically translates them, and they can pinpoint places where there looks like an outbreak might be ready to occur. So this system is really keeping us all safe today, and it's working through technology and machine translation, but very few people actually have heard of it and know about it. So that story, I think, is an important one for anyone interested in healthcare.
I think that people might be kind of surprised actually to learn that automatic translation or machine translation is being used that way. But it's not exactly the same kind of technology as as a free online translation tool like Google Translate. Can you tell us a little bit more about it and how it works?
Yes. So machine translation, most kinds are actually not free. And this is what I think is so interesting. So most of us know that Google Translate is free, but it's only free up to a certain point. If you want to use it for any large scale, you actually have to pay for it. They charge you for using it if you want to translate any large volume. And it's the same for Microsoft Bing Translator as well. So those kinds of automatic tools, a lot of times people think that they're free, but they're not really free for any widespread use. There are really a few types of machine translation or automatic translation. One is rules-based, which basically you're writing rules to say, when you see something that ends in A, treat it as feminine and make sure that the noun matches the adjective, those kinds of grammar rules. And statistical, which is similar to Google, Google Translate is a type of statistical machine translation. So that type of machine translation uses lots and lots of data. So the more data it has, the better the likelihood is that it will produce a correct translation. This is why for some language pairs in Google Translate, you'll see very good results because they've had lots of time to work on them, work on it and add more data over time. But for other language combinations, it's really poor. And for healthcare purposes, it's not suitable for any language combination. But there's also a type called hybrid, which is a hybrid of rules-based and statistical. The type that the GFIN program uses is using rules-based and is using lots of data as well. I wanted to mention another type of technology as well, which a lot of people ask me about, which is crowdsourced translation. We do have several stories in the book about crowdsourced translation. And this is basically when a community of people are involved in the translation. Often they are not translators. They are just people who happen to speak 2 languages, or sometimes they are only really specialists in 1 language, but they can still participate in this activity. That's not free either, by the way. A lot of people think that that is done in order to save money, but it actually does cost money to build a platform and to provide a space for a community to translate collectively. That's the way that Facebook translated their interface, was by having all their members weigh in and vote, how would you like to say, write on your wall in your language? They let the community members decide. So it's a very different type of translation as well. And then there are things like translation memory and terminology management. And we do talk a little bit about translation memory in the book as well, but not a lot, because this is really not a book for specialists. This is a book for anybody who wants to read about language and how it affects your life. So we purposely, I kept thinking when I was writing the stories, I have to make sure that my grandfather can read this and understand this. I want to make sure a non-specialist who isn't even interested in language or translation will find it entertaining, and will find it fun, and will find it accessible. With regard to all of these technologies, they're all used in different ways. I just think it's important when we think about technology that we not lump everything together. And of course, none of these can replace professional interpreters or translators.
Well, that's certainly something that those of us in the profession have been saying for a very long time. But I have to say, as having had the opportunity to spend the last year of my life in a language that I am trying diligently to learn, but is a very slow process, I've relied on Google Translate more times than I would care to admit. And the reality is that, as we were saying before, in so many circumstances, we just don't necessarily have access to professional interpreters or translators. And I think that while we might like to grumble a little bit about the idea of machines, quote, replacing interpreters, I think that there's a very important place for technology, especially easily accessible technology, when you're out on the streets, when you're doing things where you don't have access either to a person or a computer, something that's in your hand that will help you get through something big or small when there are really no other options. And so it is true that certainly the commercially or freely available technologically based interpretation or translation services are not brilliant. And I've certainly run across some laughable translations myself. But people are very comfortable with them actually here in Japan, and it's quite common to see two people whipping out their smartphones and messaging each other, so to speak, back and forth using Google Translate when there's really no other way to communicate.
Absolutely. Yes. We interviewed the inventor of Google Translate. His name is Franz Oak, and we have a story about him in the book. And it's interesting because a lot of people, I think, like to demonize Google Translate and don't realize some of the good that these tools have really brought to the world. I think now that people are becoming more aware of these technologies, they're starting to be able to distinguish, well, maybe I can use this to ask for directions if I'm lost in a city where I don't speak the language, but maybe I shouldn't be, as a doctor, providing health care, providing instructions to a patient about how to take their medicine. And so I think it's very important, now that more technologies are known to the average person, that we start to be clearer about when and how to use them. I think that's really important, and something that we do stress in the book in various different stories.
So companies like Google and Microsoft obviously have a lot of money to spend on the kind of research that's needed to make technological interfaces for translation more of a higher quality. Do you think that it's possible that interpreting will someday be completely automated?
Well, I actually asked that question to a futurist by the name of Ray Kurzweil, who's pretty well known among technology folks. And his answer was not anytime soon. This kind of work is very, very difficult, especially when we think about speech automation. It's one thing to automate written text. As you can see here on the slide, we've got between 6,000 and 7,000 languages in the world today. And I have here Google Translate currently can translate between English and 65 different languages. But there's a problem. There's a limit to how much Google Translate can actually help us with. only 2,261 of those languages have writing systems. So the
Hmm.
majority of the world's languages do not have writing systems. You know, there are hundreds of sign languages. In Latin America alone, we have 18. So written language translation is insufficient to completely remove the need for human intervention, at least at this point in time. Speech automation is extremely challenging when you compare it to text translation. And when I interviewed Ray Kurzweil, you know, his thought is that the field of translation is much like the field of music, and he's the one who invented the first synthesizer for piano. You know, the synthesizer that can replicate sounds of instruments. And his analogy was basically that, you know, professional musicians thought that they were going to be out of work when he invented the synthesizer, but in reality it just changed their profession, you know, and then, you know, gave way to digital recording and lots of jobs in technology and other facets of music. So his thought was that it won't, you know, technology is not going to replace translators or interpreters, but it will actually help the professions evolve. I actually included a picture here of someone who we mentioned in the book as well. Her name is Maria Clara Charupihua, and she is from the Shuar community. Shuar is a language spoken in the Ecuadorian Amazon. Maybe her photo won't show up now for me, but she there is reading, oh, there she is. Her language is not spoken by very many people, and she's reading here from a book of poetry. She's a poet, and I've been translating her poetry into English, and there's a word in her language that means the fragrance that is emitted through the song of a plant. The fragrance
Hmm.
that is emitted through the song of a plant, you know. So this is such a huge challenge for a human translator to come up with something in English that will sound poetic and beautiful and not ruin the lyrical quality of a poem. And when you think about those kinds of challenges for translators, it's hard to imagine that a machine will ever be able to do that, especially for a language like Shuar. I think we're a long way from developing translation tools for a language like that.
Oh, that's pretty beautiful. And there were lots of, you gave very interesting examples of lots of different kinds of unusual and elegant translations in your book. My favorite was the Inuktitut translation for internet, where they used a word that's a traditional term that means traveling through layers. And it refers to what a shaman does when he travels across time and space to find out about living or deceased relatives, which the translator says is very similar to how the net is used now. I think that's just gorgeous. Um, let's go on to something a little bit lighter. Tell us a little bit about the use of humor in that you managed to highlight in your book, and then I can see also that we're starting to get lots of questions from people. So we'll move on to that too.
Sure. I won't spend long on this, but did want to share a couple funny stories from the book. We have a lot of mistranslations and things like that. One of them that is quite funny is Clairol, and this was not too long ago. They launched a product called the Mist Stick, which is a steam-based curling iron. And it did not do very well in Germany. Those of you on the line who speak German probably know why, because the word mist means manure. And so, you know, this even a large company like Clairol can make a major mistake. We have lots of examples of unfortunately named products in the book that I think are quite funny. We also included an example there of a mistranslation that led to a misunderstanding about Valentine's Day in Japan, which is coming up there for you, Julia. And if you're wondering why all the women give men presents on Valentine's Day, it's actually due to a mistranslation about what the purpose of Valentine's Day was. And that's why there's a,
Really?
yeah, it's due to a mistranslation. It's mentioned in one of the little sidebars in the book. And they have, we mentioned that there's a separate holiday in Japan where the men give the women white chocolates, and that was introduced later. But yeah, it was basically a Western company that was trying to help Japanese people understand what the traditions were on Valentine's Day, but it got mistranslated. So the women give men chocolates on Valentine's Day in Japan.
That's a pretty powerful impact from one mistranslation.
Yes.
It's a huge business here.
I wonder sometimes if some of these are done on purpose, you know. There's another one that I thought was quite funny. We mentioned the gift that Secretary of State Hillary Clinton gave to Russia in order to reset the relationship. It was a big reset button. Unfortunately, the word reset was mistranslated as overload. So we have lots of
That's
those funny examples in the book.
that's great. And what about the topics of politics and religion? I noticed in the book that you spoke at the Jimmy Carter Presidential Library, and that President Carter and his wife actually sent a letter to thank you. You talk about the important role that interpreters play in politics, and there are some fascinating stories about how that nexus between language and translation and knowledge and the conveying of expertise actually gets handed down from one presidential generation to another through an interpreter. I thought that was fascinating. Tell us a little bit more about these two topics.
Sure. Well, I think it's funny, you know, the two topics were never supposed to discuss in friendly company are politics and religion. But interpreters can't help but talk, you know, about those things because they are thrust into the middle, and same for translators, especially with religious texts. But regarding that example that you mentioned, we profile an interpreter by the name of Harry Obst. He was an interpreter for 7 U.S. presidents. And yes, sometimes the presidents would actually ask the interpreter for advice on how to deal with a particular head of state because the interpreters had been there, whereas the presidents are changing with every administration, you know, every 4 or 8 years in the United States. So yes, the interpreters actually play a pretty important role in politics and international relations, much more important than a lot of people know. We also included a story in the book about translating for the European Parliament. And I love a quote from Olga Kosmidou, who is the person in charge of the interpreting service there, where she basically says that for all those 506 language pairs that they have in order to enable European Union citizens to communicate and really for, you know, everybody to have their say and for people to have understanding, it costs the average EU citizen the price of a cup of coffee per year. So people often think language services are very expensive, but when you look at them in the grand scheme of things, the cost is usually pretty minimal. We also talk about translation and interpreting and the role that they play in world religions. I won't talk much about that today, but we do have plenty of stories about religion as well.
Great. And so one last question before we take some of our audience questions. Of all of the many stories that were included in your book, which one is your favorite?
You know, it is hard to choose, but I have to narrow it down to one man by the name of Peter Less, and I have an image of him here. Peter Less's story is without a doubt my favorite in the entire book. He was one of the interpreters at the Nuremberg trials, where the masterminds of the Holocaust were tried. And Peter was just a young boy at the time, but his entire family was killed in Auschwitz. So here he was interpreting for the masterminds of the acts, the atrocities that were responsible for the deaths of his family members. And he was able to interpret for them faithfully and in an unbiased way and holding himself together the way that every interpreter must do, but under conditions that I think very few of us can actually imagine. So he's still alive today, and I had the fortune of meeting him not just once but twice. He lives, his home is outside Chicago, and he's a really incredible man. And I hope the beauty of his story and just the dignity with which he approached his profession comes through in the book, because his story is really one to remember.
It really does, and it just it's a I think a really good example of not just how the people who we translate or interpret for are affected by the work, but how the interpreters and translators themselves are affected by it. And sometimes the effects can be very profound and life changing in a way. And that was obviously the case for him. So let's go on now to our audience, and we're getting a lot of questions in, so we'll do our best to get to as many as we can. I think a lot of people were taken by your discussion of machine translation, and one of the questions that we have is about the accuracy of machine translations, and this has actually come through in a couple of questions. So not just how faithful are they, and what's being done to improve the accuracy of them, but also whether in many cases that the output of machine translation is being post-edited to produce more accurate translations. So can you take us behind the scenes a little bit there and tell us a little more about what's going on?
Sure. The question of how accurate is machine translation is almost like asking how accurate is an interpretation. It really depends on who's doing it, and it depends, same thing with machine translation, depends on what system is being used, what language combination, what information is being used to train the system. Generally, for most systems, they require training either through creating rules, like I mentioned with rules-based translation, machine translation, or through using large amounts of data, also known as corpora, bilingual corpora, which are basically parallel texts that have, for example, English on one side and Japanese on the other. Through using that information, these tools can be trained. Now, if they're trained for a very specific domain, let's say we could train a machine translation tool to just translate those buttons on Julia's heater from Japanese into English. That's just a small amount of information. So we could probably have 100% accuracy with that without much work, much time, much investment. But if we're talking about something that can respond to all the different types of human creativity and combinations of words that we might come up with in sentences, it gets to be much more complex. Generally, the more fine-tuned a machine translation solution is for a given domain, the more accurate it will be. This is why Google Translate and free services like that that are on the internet, or partially free, depending on how much content you have, often people don't find that they're that useful for their specific subject matter because they're not domain specific, they are general. So one practice that's quite widespread now is to use machine translation tools and then have human translators do what is called post-editing. So basically, the content will be run through a machine translation tool, and a human translator will then clean it up and make sure that it's perfect, that it sounds like human text or human speech. So in those cases, the quality can be quite good. However, depending on the language combination, depending on many, many factors, it may be faster for the translator to translate it from scratch than to clean it up. Any editor who's ever worked on editing someone's work sometimes thinks, well, it'd be faster for me to write this myself than to edit this because it's such a mess. And that's often the situation that we're dealing with machine translation. So
this is what I keep trying to tell my daughter when she tries to run her Spanish homework through Google Translate.
Yes, it's a reality. A lot of kids are, it's easy to use those tools. We would use dictionaries and whatever tools we could get our hands on when we were younger, and now kids have more options available. But yeah, they have their limits, just like all tools and technologies do.
So also on the same topic of the use of technology in interpretation and translation, do you have any concerns? One of our audience members asked, do you have any concerns about the use of video translation services, and what would be your recommendations on when and when not to use them?
Well, I would encourage whoever is interested in that topic to email me. Um, I don't have my email address here, but you can write to me at natalie@commonsenseadvisory.com. It's Nataly and I can send you an article on that topic, or maybe, I don't know if it's possible for us to send that article out to participants.
Well, we can post it on our website, which is what we'll
Perfect.
do with the questions that we're getting that we can't answer. And Candace has just posted in the chat window your email address. So if you
Excellent.
open up the chat window, then you'll see her email address right there. Thank you for that.
Great. The short answer to that question, the article goes into a lot more detail, but video interpreting is very helpful in a lot of circumstances. However, there are concerns with it, mainly because the technology in a lot of places doesn't allow for good enough bandwidth to have a really good, clear connection. Um, it can be very good if the connection is good, but it can be very poor if the connection is bad. So this is the reason that a lot of members of the deaf community have expressed outrage over poor quality video interpreting, because for visual information, it's extremely important that the quality be there. For audio, as long as, for spoken languages, for audio, as long as the audio is there, the visual aspect, it doesn't really matter if the person is that blurry. But for sign languages, it's much more important to have a very clear connection. So I do have some guidance I can share in that article on when to use it and for what purposes. But in general, it really depends on the quality of the connection. That's what can make or break the video interpreting experience.
So talk a little bit more, if you can, about crowdsourcing. Since this is a technique that's been used with some very interesting and very useful results. But I suppose the issue that gets posed by our questioner is that often within the same um, culture, there are different beliefs, there's different behavior, there's different levels of language attainment, there are dialect differences. How do those differences affect the reliability of crowdsourcing and translation?
Well, it depends. Everything depends on the crowd itself. The size of the crowd, we're calling it a crowd, but it's often more a community. The size and also the qualifications of those individuals. Sometimes it might be a group of 20 individuals who are subject matter experts in a given topic. More commonly, it's fans. Fans of a given publication or product. The fans of Twitter, for example, are translating its interface into many different languages so that they can use it for themselves. In the case of Facebook, as I mentioned before, they actually created a crowdsourcing translation platform that they patented. And that system allows the individuals to vote on how they would like to translate something in their country and their language. So in some senses, crowdsourced community translation gives the power back to the people because they're ultimately deciding how they would like, what they would like to see in terms of a translation that makes sense for them. But the only way that crowdsourcing translation can happen is if you have a community of people who are interested in that topic and who are willing to devote their time to working on it. You can't crowdsource a translation of a patent application, for example. You can't crowdsource a translation of a patient information sheet unless you have enough people who are, maybe you do have a community of nurses and health workers who happen to be native speakers of that language, and they're going to work on that project. Through a crowd, as long as it's organized the right way, you can address all of those issues of culture, cultural differences. And, it does, as long as the crowd is monitored and you have moderators and you have, certain, many of them will have policies and codes of ethics and things like that around their crowdsourced translation community, you can actually get a very good translation out of the crowd. But Remember, this is not something that you can use for just any translation. Same thing with machine translation. It's not being used for every type of translation. It's being used in specific settings and specific applications.
It occurs to me that the whole notion of crowdsourcing a translation is kind of inherent in the idea of using focus groups when you do community developments of translations, for example, for health education material. And I'm wondering now if you've seen anything that people who are engaged at the community level in doing that kind of work might use as guidelines. Certainly we have lots of guidelines for professional translators, for professional interpretation, but is there anything out there that that might guide people who are trying to get that community engagement in the translation process? And somebody else also asked, what about the issues of confidentiality that might come up in crowdsourcing?
Yes. Well, with regard to the confidentiality issues, they wouldn't be having a crowd translate anything confidential. Like I mentioned, you can't use crowdsourcing for all types of content. It generally makes sense to use it where there already is a community active. So it's used a lot, for example, for websites and for things like that. But it certainly can't be used for confidential information. You know, there are always going to be restrictions about what type of content you can put through a crowd. Also, a crowd is not going to be interested in translating things that are not of interest to them. You know, so if it's patient notes or patient's medical record, that kind of information would never be crowdsourced translation friendly. You know, in terms of the focus group aspect, exactly that is spot on. That is similar, very similar to what some companies and some organizations are doing. There are companies, language service providers, that will offer a crowdsourced translation service. So if they have a company that approaches them, they can actually assign paid translators to work on a project as a group. And there obviously is a cost involved in that. There's a cost involved in all of these things. Setting up the platform, paying somebody to moderate it, and many of the companies that use crowdsourced translation, like Facebook, like Twitter, they also pay for professional translators to edit different aspects and different types of content. So they're not getting this for free. They are actually paying for developing the technology and also paying for editors in many cases.
Great.
Mm-hmm.
So we have some questions now about roles, and one person says, given the tight financial circumstances of many healthcare organizations these days, there is some perhaps pressure to hire or use interpreters to do dual roles as opposed to being just interpreters. And can you talk, and then somebody else brings up the issue of um, the sometimes how interpreters might be asked to do work that crosses over the line from strictly interpreting to interpreting with a little bit more, perhaps a little bit of health education or a little bit of advocacy. I realize I'm sort of conflating two issues here, but I think we've got two things on the table. One is, could you talk a little bit about the issue of dual roles
Mm-hmm.
in healthcare settings? And then could you also talk a little bit about some of the additional tasks that an interpreter may be called on or feel compelled to address in the interpreting process?
Yes. Well, this is, interpreters, and I remember, working in hospitals as an interpreter, get asked to do everything. It's like we're magical. We can be everything at all times, and the health educator plus the translator plus the tour guide, everything under the sun. Um, the roles of a professional medical interpreter are pretty clearly defined. You can look at the National Council on Interpreting in Healthcare, the Standards of Practice and Code of Ethics. There are tremendous resources there Maybe we can even type it into the chat. It's www.ncihc.org. It's a wonderful resource with lots of information about what is and isn't within the role of a medical interpreter, a healthcare interpreter. At the same time, there are definitely individuals who might be working as a nurse or a social worker or any other role in the healthcare professions and may be asked to interpret. Now, this is a problem because of the fact that they might not be trained in the skills of interpreting. Now, I do believe that if a person has the aptitude and skills to become an interpreter, if they also happen to have another role, as long as they know how and when to switch roles and they know consciously what their responsibilities are for each, then that shouldn't be a problem. That should be something that they can do. And as long as they're following the ethics for both professions, they should be able to do. That said, it's very hard to switch back and forth. And I also question the efficiency in the healthcare system of having people switch roles all the time when it might be more cost effective to simply have people available, whether they be available in person, remotely. If they're highly trained and highly qualified and the technology issues are not a problem for the right settings, then it, to me, makes sense to use specialists in that area. I'm not saying I'm against dual roles. I know a lot of people who are in that situation and are able to navigate it, but it certainly is challenging to navigate it. Another problem I often hear is that people are not compensated for that additional role that they carry, and that's definitely not fair for them to have all those additional responsibilities and not be paid. With regard to interpreters and what they're asked to do in terms of language-related tasks, interpreters are not generally trained as part of interpreter training programs to do translation, written translation. And I didn't spend time on this at the beginning, but just to make sure everyone is absolutely clear, translation typically refers to written information. Interpreting typically refers to spoken or signed language. So that's the basic difference between the two, and these are two very different professions. That said, interpreters often do get asked to do translations. There are guidelines for that within the role of healthcare interpreters, how much translation, what kind of translation, sight translation versus actual written translation. So in general, it's best not to use interpreters for that purpose. That's something I can definitely say very strongly. Vice versa, it's not appropriate to use translators as interpreters either. Some research that I've done through Interpret America commissioned Common Sense Advisory to do a study. So we asked questions, and we found that the majority of interpreters working in North America actually have worked as translators as well as interpreters. So this is a confusing issue. You're not supposed to use interpreters to do written translation work, but the majority of them have actually done written translation work. Whether or not they should be doing written translation work is another story, whether they're trained to do both. So again, this problem of dual roles is one that does cross many areas.
Great. So we are exactly at the hour now, and we do have several more questions, which I'll make sure that we send to you so that you can perhaps give us some written answers. I think that before we go to the last question that I want to ask you, I'm going to announce right now that as we advertised for the webinar, we were going to give away some books to our attendees who stayed on the webinar. And I think, was that two books that we were going to, two signed copies of your book that we were going to give away, Natalie?
That's right, yes.
Okay, so we've picked two names, and the names are Carolyn Latham and Peggy Olson. And if you if you're still on the call, could you please type us a message in chat that gives us your contact email address? And otherwise, if you can't do that, please go ahead and send us an email, and then we'll make the arrangements to have that sent out to you. So just in closing, I think that this is an issue that we probably all face all the time in one capacity or another. It's the issue of "this is America, speak English" attitude. Um, that comes up very frequently, not always in the nicest of ways. Have you seen that attitude in other countries? And do you have some suggestions of creative ways or creative things that people might say to try to overcome that attitude?
Oh, absolutely. Absolutely. This is, I'll share a quick story. My husband is from Ireland, and for many years, Ireland had almost no immigration. Everybody was leaving the country and going elsewhere. And then the country became, had financial, economic success, and of course attracted a lot of immigrants from other countries, and quickly had a sudden need for interpreters for languages other than Irish Gaelic, which was historically the only uh, language for which interpreting was really needed. And I remember shortly after the economic boom getting into a taxi, and the taxi driver was saying, "Oh, thank heavens you speak English. I can't stand all these people coming here, all these immigrants coming who don't speak English." And I did say to him, "You realize that for many, many years, Ireland has been the one that is sending immigrants to other countries, and might not always have spoken the language." But we get into those discussions with people in the world. This is actually a problem in many countries. I will say that some countries have policies that are more favorable, and of course some countries have more multilingual people to begin with than we do in the United States. Where multilingualism is less of a problem, you can locate people who speak other languages more readily. But we, of course, in the United States have a tremendous diversity of languages as well to deal with, and there are many cultural factors at play. We did write about this in the book, and in fact, it's one of the main reasons that I wanted to write this book, to show people that diversity is an asset to society, and through these stories, opening their eyes to show them, language can be fun, and language has hidden gems and treasures and things that make us smile and things that help us understand people from a background very different to ours, and help us understand a different way of viewing the world. And I hope that that is what the book enables, that we can get past that barrier. uh, and I've traveled widely throughout the world, and I have experienced this in pretty much every country that I go to. There will be people complaining about one group or another, and that they don't learn the language, or that they come to this country. It's actually, I think, something that most of the world has in common. um, so yeah, I think that is one of the main important points that the book hopes to address, and to show people that language can be an asset. It can help you if you're, if the person you're trying to convince is a business-minded person. You can talk about how it will help them enter new markets. You can talk about how it can prevent international conflict. There's just so many aspects of how overcoming language barriers benefits our world.
Wow, that's a great sentiment to end the webinar on. And I want to thank you again, Nataly, for being with us. I also want to mention on our last slide that there's more information about how to get the book, and we will also post that information on the DiversityRx website in case you have trouble finding it. But there are many places, both independent and large, that you can find Nataly's book, and I highly recommend it. It's such a great read, and it really does, I think, convey the enthusiasm for the richness that language offers to our lives, and the incredible work that interpreters and translators do. So I want to thank you for being with us, Nataly. I want to thank you for writing the book, and encourage you on the great work that you continue to do, both in your professional paid work, as well as in the many different writing areas that you are out in the world. Um, And we hope to have you back with us again sometime with a new project.
Thank you so much. It's been a pleasure. And thanks to everybody who's been on the line for joining and for taking an interest in this topic. And again, thanks to everybody from DiversityRx and Julia in particular, especially for being
Thanks.
up so early with us in a cold room.
It was a pleasure. Lots of fun. Thanks again.
Thank you.